Good evening. Frontline medics have told the BBC about their concerns over a lack of personal protection as they fight coronavirus in the UK. The British Medical Association says there's growing evidence that thousands of frontline doctors are still not getting the equipment they need to treat patients with coronavirus. The Doctors' Union says it means some medics are likely to become very ill and some may die. But the government says 15 million masks have been delivered to NHS trusts across the country since Monday. 41 more people have died in the UK from coronavirus in the past 24 hours. They were aged from 93 to 47. All had underlying health problems except for the 47-year-old. It brings the total number of deaths to 465. Meanwhile, more than 500,000 people have now volunteered to help care for some of the most vulnerable people over the next 3 months. With more on the challenge facing the health service, here's our health editor, Hugh Pym.
I am 39 years old and I am...
Karen is 26 weeks pregnant. She wants everyone to know just what it's like to have coronavirus.
I've just been told that I have COVID-19 and I've been ill for 2 weeks. I've been in hospital now since Saturday and today is Wednesday. I have pneumonia on both lungs and I'm fighting for me and my baby.
The virus can infect all ages. 5-year-old Alfie has been seriously ill with symptoms. He's back now from hospital and recovering at home, but his mother Lauren thought at one stage she might lose him.
Obviously I've seen it all on the news where everybody's got coronavirus and then the next thing, people are dying from it. And to see him so poorly, I didn't think that he was going to be able to come back from it.
For doctors and nurses treating patients, supplies are urgently needed. This sportswear firm in Northern Ireland has a major deal to produce scrubs for NHS staff. But there are reports there still isn't enough personal protective equipment in some hospitals and GP surgeries, even after recent government commitments. And the British Medical Association, representing doctors, says its members are being let down.
My message to the government is to not talk about increasing supplies or doing something. Just please let's have the equipment now so that doctors can feel safe, feel protected and not be in this fear of becoming infected with this virus, which would cause catastrophe for the health service.
The Department of Health said over the last 2 days more than 15 million face masks had been delivered to the front line, as well as millions of gloves and eye protectors, and the full weight of the government was behind the effort. This hospital in Essex said it was a priority to protect staff and there was enough specialist equipment. Some local health workers, though, are worried about the pressure building with COVID-19 patients.
I'm petrified of going to work. I'm petrified, but I have to go to work. You have to stay indoors. There is nothing so special out there for you to be going out. Yeah, the sun's shining. Yeah, you might be dead in a few weeks because you wanted to go out and go get some fresh air.
Converting this East London conference centre into a giant temporary hospital is underway. NHS and military staff are working together to get it ready. One worker posted this video of the inside of the building.
We've got 4,000 beds to go in, 2 morgues. This hall is 1 kilometre long.
Because of social distancing, the Queen's weekly audience with the Prime Minister was held on the phone. These pictures were posted on the royal family Twitter account. At some hospitals, doctors do feel there have been adequate preparations.
The feeling in the hospital, while there is one of apprehension, I do think from the most junior of trainees to the most senior consultants and the managers as well, everyone's really been pulling in the same direction.
Chloe Middleton was 21 and has died after testing positive for coronavirus. It's thought she had no underlying health condition. Her mother said on Facebook, "To all the people out there that thinks it's just a virus, please think again. Speaking from a personal experience, this so-called virus has taken the life of my 21-year-old daughter." Hugh Pym.
Scientists mapping the spread of coronavirus say they are hopeful the NHS will be able to cope with the expected surge in cases. They predict the outbreak may peak in 2 to 3 weeks if people follow the stay-at-home rules. The family of a victim who died on Sunday are appealing to the public to obey the government's advice, as our medical correspondent Fergus Walsh reports.
Doreen Hunt died on Mother's Day in Luton and Dunstable Hospital from COVID-19. The 72-year-old had underlying health conditions. Her family are appealing to the public to stay at home to fight the virus.
I'm sad that she's gone, but I'm more angry with people who aren't taking notice of the warnings. You might catch it, you might give it to somebody else, you might touch something which somebody else touches and you've killed a relative. You just don't know.
These deserted streets show the stay-at-home message has got through. Add to that the rapid expansion of hospital beds, and a leading scientist modelling the outbreak has told MPs he's optimistic intensive care units will cope.
There will be some areas of the country which are extremely stressed, but we are reasonably confident, is all we can be at the current time, that at a national level we'll be within capacity.
That will mean huge numbers of lives would be saved. Scientists think deaths are now unlikely to exceed 20,000 in the UK and could be lower if social distancing is maintained. The scientists tracking the coronavirus outbreak say there's a lot of uncertainty about their predictions, but say if the current restrictions work as expected, then the peak of cases in intensive care could come in 2 to 3 weeks and start to decline thereafter. The challenge then will be how to restart the economy without having a fresh surge of cases. Once the outbreak is under control, the key will be to ramp up community testing and contact tracing of those infected, something that's not happening now. The long-term hope is a vaccine, but when might it be ready?
We could have millions of doses of vaccine available in as little as 6 months, but that's a huge effort required from today to upscale manufacturing at risk when we don't even have the first doses being fully tested in humans.
So there could perhaps be a way through this pandemic, but it will rely on all of us playing our part in the war against an invisible enemy. Fergus Walsh, BBC News.
Prince Charles has tested positive for the coronavirus. Clarence House says he is displaying mild symptoms but is otherwise in good health. The Duchess of Cornwall has also been tested but does not have the virus. Here's our royal correspondent Nicholas Witchell.
Burke Hall today, the Prince of Wales's home in the Scottish Highlands. It's here that the heir to the British throne is self-isolating, as is his wife. They'd arrived here on Sunday night. He was already showing mild symptoms. He was tested on Monday. The results came through late last night. In a statement, Clarence House said, "The Prince of Wales has tested positive for coronavirus. He has been displaying mild symptoms, but otherwise remains in good health and has been working from home throughout the last few days as usual. The Duchess of Cornwall has also been tested, but does not have the virus." Scotland's chief medical officer stressed that the Prince had been tested in line with normal procedures.
He was tested for clinical reasons. I'm very pleased also that he is very well and, as with many people who have had this virus, has had a mild illness.
The Prince has met hundreds of people over recent weeks. On the 6th of March in Newquay, he was still shaking hands quite freely. On the 9th of March, he was at Westminster Abbey with the Queen. Handshaking was out. Charles adopted the Indian Namaste greeting instead. But 2 days after that, on the 11th of March, he was evidently having difficulty remembering the no handshaking rule. At that stage, it was still something to laugh about. On the 12th of March, the Prince was at Buckingham Palace for an investiture. He also briefly met the Queen. Buckingham Palace is usually pretty sparing when it comes to information about the health of senior members of the royal family. On this occasion, though, the palace was quick to say that the Queen remains in good health. The Queen left Buckingham Palace last week for Windsor, where she's been joined by the Duke of Edinburgh. According to the palace, all appropriate advice is being followed to shield them from the virus. Nicholas Witchell, BBC News, Buckingham Palace.
Sweeping emergency powers to tackle the coronavirus crisis have become law after the coronavirus bill cleared the House of Lords without amendment and was given royal assent. Parliament has closed tonight, and in his last appearance at Prime Minister's Questions, Jeremy Corbyn urged Boris Johnson to make himself available for scrutiny during the parliamentary recess. Here's our political editor, Laura Kuenssberg.
Can you all go home, please? It's not a holiday, it's a lockdown.
Not a time for lounging in the park.
Yeah.
Not a time to be anywhere you do not need to be.
So the government only want people to travel where it's necessary.
And that means from tonight, he won't face public questions from MPs for at least 4 weeks.
Have you got a grip of this crisis?
Parliament's closing early, but time today for an hour of pressure first. No one under any illusion about the struggle ahead.
We are coming together as a nation in a way that I've not seen in my lifetime, to help to defeat a disease and to help save the lives of many, many thousands of our fellow citizens. And we all understand that that will involve a sacrifice.
But fine words don't mean the government's approach is effective enough. By chance, the last such outing for the Labour leader too.
If you're living in a small flat and you're told to isolate and you have a large family and a large number of children, the levels of stress are going to be huge. So we need clarity, not confusion. We need delivery, not dither.
This is an emergency. The truth is that the health and economic costs of this virus are deepening by the day. People deserve strong leadership.
A plan for the self-employed is promised for tomorrow.
All the staff, as you can see, it's a ghost town in here. All the staff just up and left.
But none of the MPs who would have scrutinised it will be here.
Really quite eerie walking through the Commons. This is Parliament Street, where a lot of MPs have their offices, normally bustling with staff.
Or back as normal anytime soon.
There's definitely lots to do, and it's going to be a very odd time.
While they packed up themselves, they packed in fears about making ends meet, Brits stuck abroad, testing for the virus, and so much more.
The 80,000 care homes around Britain, what date will they expect tests to be carried out on the day that symptoms emerge?
Can you help more people to make the right decision by giving an absolute assurance to the 5,000 self-employed people in Mansfield?
Charities, including those on the front line of our national response to coronavirus, working with the seriously ill, the elderly, the young, they're in absolutely dire straits.
New sweeping powers for the government have passed now, so the gates will close. The questions remain.
Can you honestly say that the government is coping? There aren't enough tests, people are struggling to make ends meet, and some people are being forced to go to work when they don't feel that they're safe.
We are getting through it together with an unprecedented programme of support for not just for businesses but for workers of all kinds across the country. Never in our history has the government put its arms around people in the way that we are doing now.
Yet no politician can make a plea like this. Mark McClurg is 40 years old. He wants you to listen.
Coronavirus wants to kill you. It wants to take all the life out of your lungs so that you can't even breathe. I am grateful I am alive today.
Laura Kuenssberg, BBC News.